Proton therapy is something that's been around for about 50 years, but we really weren't able to use it well until the past 10 or 15 years. And actually in the past few years, it's really become much more available. And the reason for that is the technology. We have the technology to be able to find the tumor with MRI scans and PET scans.
So say, for instance, you have a brain tumor or a prostate cancer or any type of tumor in the middle of the body. The X-rays will damage the cancer, but they'll also damage the tissue both before and after the cancer, much like a bullet would. Protons are a charged particle. They're more like a firecracker. So based on the energy that's imparted on the proton, they can go a set distance into the tissue, have a sudden spike and release of energy, and no energy deposition beyond the tumor. So you have very little damage to the surrounding tissue.
What proton therapy offers is the highest chance of improving your patient's cure with radiation therapy and the least amount of impact on their quality of life going forward after they survive their cancer.
When we're treating tumors within the body, we often treat with many beams from different angles when we're using standard radiation machines. And with protons, instead of using 500 spokes on a wheel with the hot spot in the middle, protons can often use 1 or 2 or 3 of those, where we minimize the dose to all of those adjacent structures.
But that can be very important. If we're treating someone who has a brain tumor, we want to spare as much of the normal brain tissue as possible. If we're treating someone who has a lung tumor, we don't want to treat their heart or their spinal cord or other parts of their lung. If we're treating someone who has a prostate cancer, we don't want to treat their bladder or their rectum. So this is a great treatment to be able to target the tumor and spare the normal tissues.
Much of cancer therapy requires a multimodality approach, which means that we will utilize surgery followed in combination with radiation and chemotherapy. What Protons allows in that setting is the fact that we're able to deliver radiation to the tumor, avoid the normal tissues so that we don't compound any sort of normal tissue damage that the chemotherapy and the radiation would do together.
We know that pediatric tissues, especially the normal tissues, are much more susceptible to develop late effects from radiation than patients, than older patients. And that has a lot to do with the fact that their tissues are still growing and developing and are just more susceptible to radiation-induced changes. This really puts the emphasis on the impacts of radiation to normal tissue. And how can we decrease that risk as much as possible? Again, this is where proton therapy has tremendous advantages.
With the philosophy of providing proton therapy to all patients who need it, we're able to bring this powerful technology to patients, especially the pediatric patients that need and deserve this treatment so that they can have a productive life that is free of their cancer after we're done with their therapy.
You've just been diagnosed with cancer. The important thing to remember is that there are millions of survivors that are living today, and that cancer, as formidable a foe as it is, can be beaten.
The problem for most people when they hear that they have cancer is that it takes away their hope. The great thing about proton therapy and ProCure centers in particular is that we can give that hope back. The advantage of proton therapy is that we can treat people and allow them to live normal lives. And for many patients, that means that we can cure them, get rid of their tumors, and allow them to function normally.